Well, good evening, and I must say I'm delighted to have been asked if I would deliver this lecture, and thank you, Sean, for asking me. My key message tonight is that we continue to allow too many people with mental health problems and learning difficulties to end up in the criminal justice system without diagnosis and the right help to change their lives, and frankly, this must change. I'll begin by setting out a number of supporting messages, if I might. Those in contact with the criminal justice system tend to be socially excluded and have a history of poor contact with health services. Reaching these people is no easy task, and the NHS and prisons should be praised in having come together in partnership to improve health outcomes for prisoners. We've seen huge improvements, and yet we still need to get help to those who need it much earlier and ideally before they begin offending. Responding to these unmet needs is everyone's business, and it's everyone's interest to address them. We will only create safer communities in which to work together to use custody more effectively and divert those who are appropriate for diversion. Every day across this country, vulnerable people are being picked up by police and appearing before the courts and then going on to prison. On leaving prison, many fall into similar patterns of offending behaviour and are destined to go through the system all over again. Offering the right help in the right place for those who need it will require effective partnership between a whole range of organisations. The NHS can and must play a major part, working with criminal justice organisations and local authorities with their newly extended roles in well-being and public health. Schools, workplaces and communities have an equally important role in preventing crime and rehabilitating offenders. And we will need joined-up government to bring all of this together. This is why I was pleased to see the recent publication of the mental health strategy from the coalition government. This made a clear commitment to improve the mental health and well-being of the whole nation. Central to this was an additional investment of up to 400 million to complete the rollout of psychological therapies to all those who need help, including those that are offenders. Other actions outlined include cross-government initiatives to tackle homelessness and to get more people with mental health problems back into work. This commitment mirrors similar commitments in the Ministry of Justice's Green Paper for Rehabilitation Reform and the Home Office's drug strategy. Together, we must act upon this chance to break the cycle. The level of need and the challenge for our society is considerable. The prison population is now over 85,000, and an Office for National Statistics survey estimates that as many as 9 out of 10 of these prisoners will suffer from mental health disorders. This, of course, covers a broad spectrum and ranges from depression and anxiety through to personality disorder, psychosis, and of course includes alcohol and drug misuse. The Prison Reform Trust report that 1 prisoner in 5 has a learning difficulty that affects their ability to cope with the justice system. In the context of a big society, mental health in the criminal justice system should matter to everyone. As I've already mentioned, prisoners and other offenders tend towards social exclusion and high levels of unemployment and homelessness. Alcohol use and drug taking at hazardous levels are commonly linked to the crimes that many go on to commit. Almost 3/4 of young people in custody have been involved with or looked after by social services. What we need is coordinated action in communities addressing housing, unemployment, education, health and drug issues, to give offenders and those at risk of offending the best possible chance. And people are making a start. Work is underway to improve health and social care provision for children and young people in contact with the youth justice system. For example, work has already started to assess the feasibility of transferring responsibility for commissioning health services in secure children's homes and secure training centres to the NHS. Of particular importance to this work is also support for the transition from childhood to adulthood and the associated prevention and intervention agenda. I will argue that diversion can be effective. The government recognises this in the Breaking the Cycle Green Paper and in its new mental health strategy, which are both taking forward the key recommendations of Lord Bradley's review. The government committed in its spending review to assess options for effective diversion in police custody suites and courts. This is a welcome move, and I keenly await the findings of that work. Diversion could be an immensely valuable tool, since most, if not all, of the direct costs of dedicated services are likely to be covered by short-term cost savings in the criminal justice system. Let me take you through two examples of diversion. In both cases, this has made a very real difference to the people concerned. Firstly, the Youth Justice Liaison and Diversion Service. 15-year-old Lucy was arrested for assaulting another girl. It was her first contact with the police. A triage worker based at the police station highlighted a need for further assessment. The initial assessment by a mental health specialist worker identified anger management and bereavement problems. Lucy also disclosed for the first time a previous rape by a peer. She agreed to receive a specialist support package, and a mental health worker continued to support her during the waiting time to access this service. Lucy was supported to apologise to her victim, and because the support package addressed her underlying issues, no further action was taken by the police against Lucy. The result? Well, a better outcome for Lucy, an apology for the victim, and much reduced cost in the criminal justice system. The second example is the Elmore Antisocial Behaviour Intensive Support Service in Oxford. Ben, aged 35, was living in temporary hostel accommodation when he was referred to the Elmore Antisocial Behaviour Service. He had an ASBO for begging, which had been breached twice before, a long-term diagnosis of schizophrenia, and a history of street drinking and regular use of crack and heroin. The team worked with Ben to maintain his hostel place whilst applications were made to supported housing projects. Links were made with mental health services to ensure that he had regular medication, which in turn led to a period of more stable mental health. Ben was assessed as motivated to begin addressing his addiction issues. And 6 months on from his referral to the team, Ben was in supported housing, he had reduced his methadone script and achieved a significant reduction in crack usage. He was considering volunteering options and had just undertaken a computer course. But no one public service or agency can cut the cost or causes of crime alone. Offenders often have complex needs, but these are best served by a collective response from services and professionals, not by working in silos. It is ineffective and expensive to deal only with mental ill health and not the coexisting drug and alcohol dependency or vice versa. Children and young adults' needs require a particular kind of joined-up response because of their difficulties and emerging and challenging. It may be necessary to manage family conflict or difficulties at school if these are leading to criminal behaviour in the communities.